Hello viewers, I am Dr. Shaileshkumar Garge. Today we'll talk and discuss about hemorrhoids, that is piles, its symptoms, how to identify it and how to prevent it, and if you are already suffering with the piles or hemorrhoids, how to control it and try to avoid the surgery. These are the methods we'll discuss and talk. So piles or hemorrhoids are nothing but are the bunch of blood vessels in and around the anus region. So any patient who is having any pressure or putting pressure while passing defecation, they are high risk to develop these hemorrhoids. So main reason for the reasons for development or formation of the piles is a chronic constipation. A person who is sitting or taking too long to pass the motion are mainly high risk for the developing hemorrhoids. The second, patients who eat a lot of spicy and non-veg food, they are also high risk for developing the hemorrhoids. Third patient is any local infection in and around the anus region can increase the blood flow and are having a high risk. So these are the group of people who are more risk to develop the hemorrhoids. So now we have understood what is hemorrhoids and what are the risk factors, though who are the patients who are likely to develop the hemorrhoids. So third thing is we need to identify whether it is hemorrhoid or something else. Sometimes a skin tag around the anus can be mistaken for the hemorrhoids. So how to identify is the patient themselves feel some bulge or swelling around the anus region. Some patients can have bleeding through the piles. They can have pain during the defecation. So different patients present with different symptoms, and there are two group of hemorrhoids, that is external hemorrhoids and internal hemorrhoids. So external hemorrhoids, anything around the below the anal verge, a line will be there where there is above the anal verge are the internal hemorrhoids and below the line is the external hemorrhoids. So external hemorrhoids are in the skin region and they are very supplied by the nerves. So a lot of patients experience severe pain in and around the anus region in the external hemorrhoids. In the internal hemorrhoid, because it is devoid of major nerves, so a lot of times these internal hemorrhoids are painless. So pain can be present or absent, bleeding can be present or absent, there can be difficulty during the defecation. So these are different symptoms which every patient will not present with all the same symptoms. So if you are having these symptoms, it's very important to go and see your nearby doctor and get it examined to confirm whether these are hemorrhoids or something else. So how to identify or what investigations or how to diagnose these hemorrhoids. So once you have these symptoms or suspicious of these symptoms, then you need to get it examined by your doctor. He will do the anal examination and a digital examination, digital finger examination to see any internal hemorrhoids are there, and sometimes this can be mistaken for anal fissure as well. So anal fissure is nothing but a cut in the skin, around the skin of the anus region, which is very painful, and sometimes these patients can have a drop or few drops of blood while passing the motion, and it is very painful condition. So that can be mistaken for the fissure, and some patients can have hemorrhoids along with the fissure as well, because in the hemorrhoids you tend to push a lot to pass the motion, and in that case sometimes there can be tear in the skin around the anus region which can lead to fissure, and then fissure again, because of the painful condition you tend to put a lot of pressure to pass the motion. So it's a vicious. So there is a possibility that you can have both together as well. So it is important that your doctor examine and identify whether it's hemorrhoids or fissure, or along with both conditions, or any other things like perianal abscess, which is also a painful condition around the anus region. So once you are diagnosed, most of the times is diagnosed clinically by your doctor, and very rarely you may require some other investigations like transrectal ultrasound or MRI. So once you are diagnosed with this, how to cure, or if you are a high risk patient but with not develop the hemorrhoids, and how to prevent from developing these hemorrhoids. So first thing is that you should have a adequate diet, fiber in your diet. So take lot of fibers in your diet, which is very common mistake, and lot of patients don't concentrate on their diet, what they are eating. So what these fibers do, they are not absorbed by the body, they stay in the intestinal tract, gastrointestinal, and draw the blood and make this stool more hydrated or soft, so that you can easily pass. And if you are lacking the fibers, so what happens, the reverse happen, whatever the water content is there in the feces is absorbed by the body and makes it more solid and hard and difficult to pass through it. So you tend to put lot of pressure, and your piles or hemorrhoids will aggravate. So put lot of fibers in your diet. You can see what are the in my video, what are the food which are rich in fibers. I won't go detail into the diet for the fibers, or we can talk in our next video for the fibers. So one thing is fiber. Another thing is the drink lot of water. Hydration is very important, because if you are dehydrated, the body will try to absorb wherever the water is there in the body, like in the stools from the content, it draws and makes it dehydrated. So similar to the osmosis kind of thing, if you are dehydrated, the lot of water is absorbed from the feces and it makes it more hard. So hydration will make the water, increase the water content and make the stool soft to pass easily. In your food, you try to avoid as well the non-veg, the spicy food. More of vegetables are encouraged, and tend to avoid sitting long time on the commode, because the more you sit, the more the blood gauge engorge and the hemorrhoids can increase in size. So if you are not able to pass in 5-10 minutes, get out from there, go for a walk or do your work. When the stools are supposed to come, they'll come. Then at the time, go and back. Don't sit for half an hour, 1 hour, even though you are not able to pass the motion. That will aggravate your hemorrhoids and increase the grade and severity of the pain. So hope these piles, hemorrhoids will help you to understand how to prevent this. And if you have any comments or questions, please put them in the comment box. I'll be happy to answer them in our next video. Thank you.